Good morning and welcome to UWC News. Coming up next is Medical Mondays. Do you have tissue cysts in your body? Let's talk about it.
In studio this morning we have three special guests, Dr. Neil, Dr. Fisher and Dr. Connolly. Thank you for joining us on Medical Mondays.
Thank you for having us, and it's a pleasure being here.
Today we are diving into parasitology. Specifically, we'll be talking about toxoplasmosis. Toxoplasmosis is caused by Toxoplasma gondii. This parasite infects a third of the world's population. Toxoplasma gondii can be found worldwide and the parasite attacks humans, animals, and poultry. The only definite host is the domestic house cat and its relatives.
For more information about toxoplasmosis and particularly a case of toxoplasmosis in a patient who is immunocompetent, we now speak to Dr. Fisher.
Yes, this particular case has come up in 2011, and although it's not the first case that has come about, it is clinically important to healthcare professionals in keeping a broad mind in the differential diagnosis when they come across a patient that presents similar symptoms.
Dr. Neil, could you please tell us more about this unusual case?
Was a 20-year-old previously healthy male student with no history of smoking or any prescribed medication. He visited his doctor because he had swollen glands over the past few months. During the doctor's visit, the man mentioned a month before this presentation he observed multiple enlarged cervical, occipital, and right inguinal lymph nodes, but no constitutional symptoms were reported.
Yeah, I read in the case report that this patient was actually born and raised in America, but was of Middle Eastern descent. Also, his medical history didn't reveal any that he had been traveling or had occupational exposure or was actually in contact with a sick individual. So I'm interested in finding out what exactly his physical exam revealed.
He was non-feverish with all his vital signs in the norm. He had an enlarged, non-tender, freely mobile, bilateral cervical and occipital lymph nodes. The right lymph nodes were swollen with his palatine tonsils on the left, which were reddened. The monospot test performed had a negative result for Epstein-Barr virus infection. The doctor prescribed a 3-day course of azithromycin followed by amoxicillin due to the fact that his symptoms continued.
Did the antibiotics work, seeing that it was not a bacterial infection?
Exactly. He then returned for a re-evaluation, and apart from the enlarged lymph nodes, he still remained clinically asymptomatic. Now, another physical exam was performed, and it revealed that the lymph nodes have been unchanged, and there were no newly involved nodal chains. Investigating more of the patient's history, he indicated that he had rokibe, which is a Middle Eastern dish containing spiced uncooked beef or lamb, roughly a month ago. Now the physician then ordered a laboratory test, and the tests have revealed Toxoplasma IgG in high concentrations. Now he was diagnosed with acute toxoplasmosis and was informed regarding his dietary habits and the risk factors involved. Now, no specific treatment was prescribed apart from the resolution of the lymphadenopathy.
So, contact with the intracellular protozoa arises through direct contact with food or water contaminated with cat feces, or ingestion of tissue cysts in the undercooked meat. Our patient obtained Toxoplasma gondii from ingesting tissue cysts in raw lamb.
The prevalence varies according to eating habits, environment, and age. Now, previous studies indicated that toxoplasmosis has a greater prevalence among men, and age-dependent seroprevalence reaches more than 92% in the 40 to 50 age group. In the USA alone, 11% of individuals aged 6 to 49 years are seropositive for Toxoplasma gondii. Now, the clinical presentation, however, rely on the age of the individual and the immune status. So most patients that are incompetent, the primary infection are asymptomatic. With typical isolated cervical and occipital lymphadenopathy lasting more than 4 to 6 weeks. Lymph nodes are commonly discrete, non-tender, and doesn't form pus. So due to being so clinically asymptomatic, differential diagnoses include Epstein-Barr virus, CMV, HIV, leishmaniasis, and syphilis.
Often immunocompetent hosts might suffer from myocarditis, pneumonitis, hepatitis, and encephalitis. Following the acute phase, the patient will remain chronically infested with tissue cysts that are dormant and will cause no clinical symptoms. In this manner, humans are the accidental dead-end hosts, except for if you're a carnivore.
Toxoplasmosis in immunocompromised individuals can be life-threatening, and they generally affect the CNS. Toxoplasmic encephalitis have various clinical presentations, from acute, confused state to a subacute gradual process. Other presentations include pneumonia-like infections or multiple organ failure. Toxoplasma gondii can be diagnosed by various forms, directly with PCR and isolation, or indirectly with serological testing.
Reinfection in immunocompromised patients doesn't occur. We perform the IgG antibody test for Toxoplasmosis gondii. The IgG antibodies protect the fetus when crossing over the placenta barrier. In a primary infection, the IgM antibodies are produced and they cannot cross the placental barrier. Thus, if IgM is found in the baby's blood, it indicates a high possibility of a prenatal infection.
Common serological tests that we use include the Sabin-Feldman test, IFA, ELISA, as well as the agglutination test. The antibodies mentioned do help distinguish between acute and chronic infection.
In immunocompromised patients, direct methods of detection must be used. These include tissues and body fluids being subjugated to PCR amplification. Direct diagnosis can also be made from tissue secretions or body fluid smears that exhibit tachyzoids.
How do you go about treating toxoplasmosis?
Chronic and latent infections do not require any treatment. Sulfapyrimidine is the main drug of choice. There are various ways to control and prevent toxoplasmosis.
Yes, like washing your hands, vegetables, fruits, and cooking meat properly. Safe disposal of cat feces, and pregnant women should also avoid contact with cats. And also, do enjoy your rare steaks with caution.
I never knew Mr. Whisker's cat litter box can be this dangerous. Thank you for watching Medical Monday. Signing off.
Yep.
Alright, hi guys, Dr. One in the house. We are doing trick number 459.
Are we finishing with the
Let's do this. Let's see if we can get this.
Yeah.
Just do your part, please.
All his vital signs in the norm. He had an enlarged, non-tender, freely mobile, bilateral cervical and occipital lymph nodes.
Exactly.
The patient was a 20-year-old, previously healthy. The man mentioned a month before his presentation, he absorbed multiple enlarged cervical, occipital and right, inguinal lymph nodes, but no constitutional symptoms were reported.
But we got through it.
How late did we start?
We have been at it 5 hours, just over 5
It's going for 6 now, hey?
6 hours, I stand corrected.
So this is post-production. I feel like I need to put this on my. This one is on the couch, tired. They are working.
There's a pizza. There's a pizza.
This is for the view for real. Lunch/dinner because this video is so long.
No, hold on, stop it. I need to first take the olives off.
You don't need olives.
Okay, I think this is enough for the blooper.
I don't think so.
You're wasting my memory.
You have tissue cysts in your body? Let's find out.
Dr. 3, we cannot have this on the set, hey? Please, please.